Well, good afternoon, everyone. Today, I would like to review our state's successes and our challenges related to COVID-19. And given the growth of cases in the United States overall, I want to review how we can preserve the progress that Illinois has made. It's been over 4 months since I first stood here and delivered the first of more than 80 COVID-19 briefings. An awful lot has happened over that time. In the last 4 months, the people of Illinois have once again proven themselves to be the most resilient, dedicated, and compassionate people in the United States. To put some perspective on this, Illinois now has the lowest infection rates among all of our neighboring states, between 1/2 and 1/3 of their positivity rates. Indeed, we have one of the lowest positivity rates in the country, and it's because of the individual actions of millions of our residents. Throughout this pandemic, I have always given you the facts about coronavirus and how we're doing in the battle against it. Let me begin by saying, first and foremost, this virus has not gone away. It's still infecting people, and it will likely continue doing that for months to come. But with the difficult truth comes the news that Illinois' ability to manage COVID-19 looks a whole lot better than it did at the beginning. Unlike in late February, we now have significantly greater capacity to test for the virus and to trace the contacts of those who test positive so we can limit the spread of the infection. Ours was the first state in the nation to be able to test for COVID-19. Now, Illinois is hitting a record weekly average of more than 33,000 tests per day, crossing the 2 million test threshold earlier this week. Today, we report testing of 38,161 people. Our state testing is among the best in the nation, and we have tripled the number of contact tracers that we had just 6 weeks ago. In the first 2 months, our 7-day rolling average positivity reached over 23% at its peak. Today, we're averaging 3%. Illinoisans worked hard to get our numbers down so that we could build back some aspects of everyday life in relative safety, moving through the phases of Restore Illinois over the last few months. For over 2 weeks, all of Illinois has been in phase 4 of that plan. And while there can be adjustments to allow greater flexibility for businesses and individuals, we cannot reach phase 5 until we have a vaccine, a very effective treatment, or the elimination of new cases over a sustained period of time. That said, many people want to know if we're out of the woods, and they're wondering what's next. So I'm here today to outline the path ahead and make sure that we all know what will cause us to impose further mitigations. First, opening up our economy does not have to come with a spike in cases. Other countries have done it successfully while reducing cases and infection rates. But that requires vigilance on the part of all of us. It's imperative that individuals, families, workers, and businesses follow the recommendations of doctors and epidemiologists, that we act quickly if we see any outbreaks and upticks, signs that could lead to a surge of coronavirus infections. Our guiding principle remains the same as it has been from the very beginning: keeping people safe and healthy. The virus is unforgiving, as we have seen in states in the South and the West. So it's important when we see trends in our data that indicate a potential problem in any region of Illinois, that we need to start tightening mitigations in that region before it's too late. The epidemiologists and professionals at IDPH have determined that we need to take action in a region if we see a sustained rise in the positivity rate, along with either a sustained increase in COVID-19 hospital admissions or a reduction in hospital surge capacities. A sustained rise in the positivity rate is defined as an increase in the 7-day rolling average for 7 days out of a 10-day period. In addition, if any region hits 3 consecutive days of an 8% average positivity rate, that will require action, period. These metrics are clear. Staying under these metrics will allow us to continue in phase 4 without having to take significant mitigation steps. At the end of the day, job one is to keep you and all the people that you love safe. We're also today changing the boundaries and the number of health regions in Illinois. Unlike when we first introduced the Restore Illinois plan at the beginning of May, our growth in testing and tracing has given us a much more surgical ability to manage outbreaks and address problems locally. So going forward, we have the ability now to monitor and measure progress in 11 separate regions, based largely on our 11 hospital emergency medical services regions, referred to as EMS regions, that have traditionally guided IDPH in its statewide public health work. For ease of management of this coronavirus pandemic, we've redrawn some EMS regions, but left most of the regions as they were. For example, the city of Chicago will be in a region of its own, as will suburban Cook County. As for the collar counties, we've shifted regions based on geographic contiguity. For example, Kendall and Grundy counties will now be in a region that is not part of the collar counties. Remember that the goal of the regional lines is in large part to make sure that there is healthcare availability. This plan lays out an array of mitigation strategies that can be applied if a region breaches the resurgence metrics. These mitigations cover categories like bars and restaurants, meetings, social events, religious gatherings, and organized group recreational activities like adult and youth sports. In each category, we have 3 tiers of mitigations, allowing us to move carefully but deliberately, depending upon the severity of the situation, to control the spread of the virus while continuing to allow a region to be open to the greatest extent possible. These mitigation options allow us to move decisively without reacting more broadly than circumstances require. We're focusing on detecting and mitigating localized outbreaks by working with municipalities and counties to take targeted steps to contain outbreaks. With our new mobile testing units, greater testing capability, and increased contact tracing, local public health departments working with IDPH have been able to limit community spread in a number of those circumstances. Unfortunately, outbreaks are taking place consistently and in every region of the state. In just the last few weeks, we've had outbreaks tied to athletic camps, July 4th parties, and churches. As I said yesterday, bars remain another concerning source of rising positivity rates in various regions. As we've seen concerning trends, it's been important to me to sound the alarm with local officials who can take immediate targeted steps before we intervene at the state level. For example, I reached out to the mayor of the city of Chicago last week because of the concerning uptick in their positivity rate. I'm also deeply troubled by outbreaks that we're seeing all around the state tied to activities like youth sports, like in Lake Zurich, where dozens of students and parents have tested positive in a related outbreak, and in Knox County, where a teen softball league is also experiencing an outbreak. Remember, the degree to which we can reduce risk and restore aspects of our daily lives is still unfolding. We're continually evaluating what works and what doesn't work. And we're taking a good hard look at how youth sports fits into that conversation. Let me reiterate what I've said from day one. IDPH and I are ready to take immediate action there and elsewhere if trends in the data require it. Looking ahead, I know that many people have concerns about in-person learning in schools. As a parent, I share those worries. Every school district is different. Different building sizes, different flows of students across campuses, different numbers of students and teachers per square foot. One size doesn't fit all. So the Illinois State Board of Education recently released guidelines for how districts can return to in-person learning. There's room for adaptation to local circumstances in the guidance, but there are some requirements that must be adhered to. For example, face coverings, distancing, and classroom capacity requirements. In every decision relating to this viral threat, schools must focus on giving our children the best education possible while offering the greatest consideration to their health and the health of their families and all of those who work in our schools. And as indicated by the ISB instruction, hybrid schedules and remote learning are likely to be a part of that solution. Parents should be fully engaged in understanding what policies each district is moving toward, and should be fully included in discussions of how to adapt to local and individual needs. But to be very clear here, any district that intends to disregard this guidance is gambling with the lives of our children, teachers, and families. Districts that don't live up to public health guidelines and standards and don't make a genuine attempt to protect their communities from this virus could be held liable in the courts by community members who are ill-affected. I'm a father. I understand that parents are worried sick about having to choose between seeing their kids miss even more in-person schooling at critical ages and the very real threat of this virus. Good people with good intentions can disagree on how and when kids should go back to school. But let me be clear, I wouldn't let my own children return to a school where masks are not mandatory, and serious effort hasn't been made to keep students distanced during the day. This should not be controversial. Remember, the degree to which communities can mitigate risk and restore more normalcy to daily life in the months ahead is, to a large extent, in the hands of the people of our state. Taking precautions, following the mitigations recommended by doctors and epidemiological experts, like wearing masks in public places and keeping some physical distance, are necessary for us to keep all Illinoisans safe and healthy. Throughout this pandemic, it's been my priority, shared by Dr. Ezike, IDPH, and the rest of my administration, to ensure that Illinois would not be too proud to evolve our path forward if new information encouraged us to do so. 2 months ago, when I introduced the Restore Illinois plan, I said, we can and will make this smarter as we move forward. And we're doing that today, as we have all along the way. Scientists and doctors and researchers learn new things about this novel virus every day. That fact should humble us. There's a difference between learning by questioning and sneering in the face of facts. And in this moment, as we face down a global pandemic, as our communities struggle with massive economic upheaval it has brought on, and as we renew our call for racial justice, when it comes to the unknown and the uncertain, now is a time to err on the side of compassion for our neighbors and empathy for the most vulnerable among us. On that note, I want to end with a renewed call to action. The research and science are much clearer about COVID-19. There are things that we do know and we know work. 216 studies of mask wearing and distancing have been evaluated, and they collectively confirm that masks and distancing bring down transmission rates and the risk of infection. That is a fact. The single best thing that you can do to help our state, to help your neighbors, to help your community, is to wear a mask in public. So follow Dr. Ezike's 3 W's. Wear a mask, watch your distance, wash your hands. You can also help in another way. If one of the 1,450 contact tracers calls you, please answer. Also, in Illinois, everyone, regardless of citizenship status, who needs to be tested should go get one. Our state-run community-based mobile and drive-through sites are free of charge to anyone who shows up. Private insurance and Medicaid-covered families can get tested at other locations at no cost as well. On top of that, anyone listening who has a device and an internet connection can help too. We provide county-by-county data on the IDPH website that will allow you to monitor how your local community is doing at reducing coronavirus spread. That allows you to spur action by your local elected officials to provide additional mitigations to reduce your local infection rate and keep you and your neighbors safe. Everyday Illinoisans with an interest in ensuring your neighborhood is seen safely through this pandemic can use this tool to hold your local officials accountable. Illinois, this journey has not been easy. Coronavirus has ravaged families, made many people sick, and has killed more than 7,000 of our fellow Illinois residents. Not a day has gone by where I haven't wished for a magic wand to rid our people of the pain, the loss, the trauma of the last few months. But the virus is still here. Ignoring it, trying to wish it away, is not going to help us beat it. A quixotic rush to regain a shadow of our former lives today will just delay a real return to normal later on. When you go out without a mask on, host secret parties, stuff your bar or restaurant to capacity despite the warnings, ignore common sense in your worship practices, it's not a political statement. You're hurting your neighbor who is desperate to keep their business open, or your friend who has an immunocompromised child who has been inside for months, or your parents who don't have the same defenses against this virus that you may. This isn't about politics or campaigns. It's about the people that we love and care about in our own communities. Here is what I know for sure. We've seen some success, however relative, while other states are seeing surges, because the people of this state show up for each other, show up for science, show up for our doctors and nurses on the front lines, and show up for your community time and time again. That should give us all great pride in Illinois. We need to keep showing up for one another now more than ever. So thank you, and I'd like to now turn it over to our IDPH director, Dr. Ngozi Ezike. Doctor.
Thank you, Governor Pritzker, and good afternoon. First, let me just start off by saying that there is no more ardent supporter of the success that we have enjoyed in Illinois with respect to this coronavirus than our leader-in-chief, Governor Pritzker, so thank you for your tireless efforts. And second, a point of clarifications regarding the 3 Ws. There's not mine, it's ours. I saw it out there, and I think there's importance in widespread messaging that we all use the same terms. And so I saw that and said, yes, that's a great thing, and I want not just our state, I want the country to hold on to the washing our hands and wearing the face coverings and watching our distance. So if I were to make my own, I think I could inartfully come up with something. C's, the 3 C's, cover your face, clean your hands, and the last one's a little bit harder, count your 6 feet of distance. But the fact is we are still in this pandemic. No one asked for a global pandemic to rock our world, to steal our loved ones, to totally upend what's normal. No one asked for our daily routines to be disrupted. Nobody asked for our summer as what we used to know as summer to essentially be canceled or significantly changed. But the invisible enemy persists without a vaccine and without an effective cure. So yes, we stayed home initially and we made it very hard for the virus to find people to infect. And that was so key, and that's why we are sitting on the success that we have. That's why we have the lowest positivity rates for any states in our region. Less people infected meant less people hospitalized. We went from having 800 individuals lose their lives in 1 week to having under 200. And of course, 200, under 200, 150 is still too much. But please appreciate that significant decline. Our positivity rates have come down. Our hospital admissions for COVID are lower than what they were months ago. And no matter where you go online, again, other people are sharing different facts. Illinois is always on that small list of states that's trying to get it right and maintain that. So that's great. But here's the kicker. As we opened up and graduated into phase 4, that meant that more people were out and about. And what does that mean? That means there is the greater chance of getting infected. Remember, we still don't have a vaccine or a cure. But the deal was that as we go out and try to get back to some level of normalcy, that we would have the mitigation strategies in place. And those were the 3 W's: the face covering, washing our hands, the watching our distance. So I thank all those who have been adherent to those 3 W's, but we need more uptake of this, and we need more participation in this key measure that is supposed to help us fiercely guard the successes that we have seen in Illinois. As the governor stated, there are multiple, dozens and dozens of reports just this week of outbreaks from a myriad of different activities, from house parties to sports, to churches, to travel, to hotspots outside of the state. But I also want to highlight the who of many of these new cases that we're seeing. Please be aware that young people, again, breaking off the age ranges in deciles, ages 10 to 19 and ages 20 to 29, they are having higher case rates now than ever before in this pandemic. We are following this very closely, but young people and parents of young people, please be aware. This virus is now being spread by youth, by younger people. So young people, we need you to make responsible decisions to help us continue to keep our successes and decrease and minimize spread. And of course, parents, as additional support and leaders for these young adults, I pray that you will assist and guide these teenagers and young adults to make the right decisions, as everyone's decisions affects all of us. So looking at the numbers for the day, since yesterday, 1,187 new confirmed cases were reported to IDPH, which brings our state total to 156,693. Unfortunately, 8 deaths were reported to IDPH, which totals 7,226 deaths lost to COVID since the beginning of this pandemic. Again, as of last night, 1,454 individuals were reported to be hospitalized with COVID, and of those, 324 patients were in the ICU and 130 patients on ventilators. Our goal of increased access to testing is continuing. In the past 24 hours, 38,161 tests were resulted. And earlier this week, we crossed the 2 million test mark. We are reporting out more and more test results because more of you are getting tested. And maybe more of you are getting tested because you have identified exposure risks. Important reminders as we are out and trying to live our lives. We cannot control this situation without masking and distancing. We cannot. Number 2, if you learn that a friend or a relation or a contact of yours tested positive, you have to undergo a 14-day timeout. You need to wait at least 6 to 7 days after your exposure to get tested, because that's a better chance of actually showing a positive test result. If you find out a day after you got contacted by your friend that the day before they were positive and you were with them just that day before, it's too soon to get a test. So please, a 6 or 7 day window after your exposure is the ideal time to get tested. But even if that test is negative, a negative test does not buy you out of the 14-day timeout. I know that's hard to take. You're feeling fine. You got an initial test. It says you're negative. But that test is not enough to take you out of the 14-day timeout. We have many individuals that have not been positive on day 6 or 7. Up to 30% of people might still test positive or develop symptoms on day 8, 9, 10, up to day 14. So in the interest of not spreading it to other people, we have to do that 14-day quarantine. Also, if you have a positive test and you don't have symptoms, you still have to isolate for 10 days. Not having symptoms does not mean that you're not infectious and does not mean that the test was wrong. And to help the general process, please, we have to be vigilant. Keep track of where you have been and who you have been around. In the event that you do test positive, that you can help identify as the contact tracers reach out to you, as you even take your own personal responsibility to reach out to those who may have been exposed. Make sure you notify your employer, your social networks, your family networks, your religious groups, your sports groups. Please be a responsible citizen and share to people who may have been exposed in case you get to them before the contact tracers do. Cases are increasing across the country, and even in some areas in Illinois. With our local health departments, we are aggressively identifying outbreaks in Illinois to control them before they spiral out of control. I continue to salute my team at IDPH as well as all of our local health departments for their work since the beginning, but it's not over. So outbreaks are identified in several different ways. Local health departments can identify them through case investigations, and that's why it's so critical that the public cooperates with our contact tracers. When they call, we need as much information as you can provide. We're still ramping up the number of contact tracers, so we're going to have even more people making these calls, and we need your help in giving them complete information. Facilities may contact the health department to report that a group of individuals have tested positive or have symptoms that are concerning. And then IDPH also looks through our many data sets to identify different clusters. We want to identify as much as possible. We need to know where it happened, who was involved, how many people, where were the likely exposures. It can be, as mentioned, within sports settings, bars, restaurants, factories. We've seen daycares, any place is possible. Local health departments in consultation with IDPH will recommend control and outbreak response measures, which include quarantining of the close contacts. That's the 14 days from the exposure to wait and see if symptoms will occur. Testing plans are shared and improvements are needed to prevent transmission with infection control procedures in place. A few weeks ago, we announced the arrival of Phase 4, which was a testament to how well we as a state responded to this pandemic. We did it together, and we are still needing to work together to get through this. The 3 W's will lower the spread of the virus. That's incontrovertible. The important actions and sacrifices today will directly affect what school looks like in the fall. So we all have a hand to play in what our future looks like. Please bear any inconvenience that you think is associated with wearing a face covering. Bear that inconvenience to prevent much larger inconveniences down the road. I implore your support. I implore you to follow the 3 W's. I implore you to take care of your fellow resident here in Illinois. Thank you.